This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, well, good morning. Happy Monday. So this is a medical minute from a case that we saw yesterday. It was kind of interesting, something we don't see all the time. So it seemed like a routine case, 70-ish-year-old female with abdominal pain, vomiting. She'd have some distension as well. A lot of times we see people like that find a small bowel obstruction or, some colitis. And, she had the regular tests. CT scan showed a sigmoid volvulus, which is something that we don't see all the time. And basically it is when the sigmoid colon twists. You could think about like an inner tube kind of twisting either 180 degrees or potentially even 360 degrees. And it's something that, like I said, is not super common. I read some statistics. It's about 10% of intestinal obstructions in the United States. But interestingly, around the world, it's much higher, thought to be like 50 to 70% of intestinal obstructions. And I think it's because of, like strange parasitic infections they have or other kind of weird diseases that make people more prone to get these. But regardless, in the United States, it's more common in elderly patients who have had bouts of constipation over time. The sigmoid colon can get enlarged and kind of redundant, and then it can just twist, like we said. It can cause eventually perforation if not picked up. You can think that if you have your sigmoid colon just completely blocked off, it can keep getting more and more distended until it can perforate, and that can obviously be a bad surgical emergency. If you catch it early enough before they perforate, it can be initially treated with a sigmoidoscopy, like a partial colonoscopy, where they can kind of untwist the colon and temporarily fix it. But even if that does kind of resolve it initially, most of the times people have a elective sigmoid resection kind of the next day because they're prone to recurring. So, like I said, something we don't see all the time, but something that's out there and kind of interesting. Thanks, guys.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.